Hi everyone, I'm Kara Huggins and today we're really lucky. We've got a patient of mine with us to discuss her desarial treatment, which is vaginal rejuvenation that she had back in November. I think it's a really great opportunity if you're thinking about having the treatment done or if you're not sure about how effective the treatment is, for you to understand it from a patient's perspective. So Jill, do you mind, just for the sake of anybody listening to this at home, talking through what led you to having the treatment done in the first place?
So going through the menopause about 10 years ago, that was one of my main symptoms. At first it was itchy, sore, and then gradually it got drier and drier. I used all the creams that you could get at the chemist. Yeah. And then gradually I had to go to my GP. She prescribed the topical HRT cream, which I used religiously, but still better, but not brilliant.
Not a huge improvement. Yeah. And did the dryness and the irritation affect you every day, or was it just with certain activities that you did?
Obviously with sex had to be more planned and it was more difficult. Yeah. But just everyday things, riding a bike, wearing jeans irritated me. Lots of, if there was a seam round that crotch area, getting out of a car even. Really? And it got to the point that I would sometimes bleed. It was so very sore. And what's the word? It's see-through, where it's the skin looks so
just like raw and wearing.
Yeah.
When you went to the GP, was there any mention of any treatments
like
desarial?
No, I was just told vaginal atrophy. It was very common, and that was it.
And that's just part of menopause, and that's just what you've got to live with for the rest of your days?
Yes.
Okay, and when did you find out about the desarial?
I saw something on the TV about the menopause, and it was on each night on Channel 4. One of the evenings was about vaginal rejuvenation, but it was in London and it was Harley Street and it looked, out of my league totally. And I thought, well, obviously there is something there. And then I came here for a facial and I was just looking through your brochure and I saw it. So I asked to have a word with you.
You did, and we had a consultation and we did a very quick assessment, didn't we? We had a little look. And it absolutely was vaginal atrophy. So if you don't know what vaginal atrophy is, it's basically just volume loss in your labia majora. Your labia majora is there to protect everything else within. And as we age, that ages too. So your face ages, your hands age, your neck and your neck age, but your vagina ages as well. And as that volume is lost, everything within is more exposed. You don't have the shock absorption. And you start to get a chafing of your mucosa and your labia minora, which is the inner labia, and that leaves you very uncomfortable. That teamed with a drop in your estrogen levels during menopause can, for a lot of women, nearly 60% of women will suffer with vaginal dryness and irritation, even after being on HRT or using HRT gels, estrogen topical gels. And that's when desarial might just be the right option for you. So how did you find the consultation process?
You reassured me. I was very embarrassed to start with, but you put me at my ease.
And it's not something we should be embarrassed about, is it?
No. And yes, it was a little painful, but quick. Just over and done with, really. Yeah. Took a couple of paracetamols. Went to book club afterwards.
Did you?
Yeah.
Hey, check you out. What was your discomfort like in the hours, in the days afterwards?
It was fine. I was really prepared for it to be really bad and sore, but it wasn't. It was maybe only the first 2 days that I was taking paracetamol.
Amazing. Yeah. And did you get any bruising?
A little bit of bruising internally. But no.
Cleared up quite quickly?
Yeah.
Fantastic. And how long, roughly, would you say before you started to notice any alleviation from the irritation and the dryness?
About 4 or 5 days.
Fantastic.
Yeah, and it's just got better and better.
Has it?
Yeah.
Brilliant.
Yeah.
So
Into the fact that I now forget to put my topical cream. I use it twice a week.
Yeah.
And I never forgot because I needed it. But now I forget. I think, I haven't taken it. I haven't used it.
And I know it's a bit of a personal question, but sex life?
Yeah, good.
A lot better?
Yeah, going back to the old days.
Oh, good. Mega. Shop's open.
Shop's open.
Fantastic. So Desiril on average lasts around, Desiril for the inner mucosa lasts around 6 months, manufacturers say. Our patients have found that it's lasted up to 12 months. Your outer labia, when we rejuvenate the atrophy, that can last up to 18 months. And in most people, it does last up to 18 months. It's likely that Jill will need another treatment, probably maybe around June time this year, of the mucosa, so the hydrating treatment. And that should then see you through the rest of the year at least, really. Thank you so much for this today. You don't know what it means to me and probably hundreds of other women that are suffering the same, that are embarrassed, that don't want to talk about it. I appreciate I haven't hit the menopause yet and I'm not suffering vaginal irritation and dryness. So sometimes coming and speaking to somebody that's younger or not at that stage of life yet is, you think, oh God, they don't get it, they don't understand it. And I don't from a personal perspective, but I do from a patient perspective. And it's absolutely not something you should be embarrassed to talk about. It's very normal. It affects 57% of women perimenopausal, going through the menopause and postmenopause. That's without the statistics for post-cancer, chemotherapy, post-childbirth, women that are breastfeeding. It really is something that affects women in their entirety, and you shouldn't be embarrassed about it. Thank you 1,000 times over. I'm sure lots of people will get lots of help from this, and I'm glad everything's good and you're enjoying your treatment.
Yeah, thank you.
Thanks, everyone.